A cancer diagnosis can change someone's world, and navigating care can seem overwhelming at first. But a good support team can get you on the right path, and that's exactly what helped this man get through treatment and get back to spending quality time with his wife. Stephen Epstein has always enjoyed being on the move.
I really, to this day, don't sit still very well. Just be moving, just be doing something. And I find it relaxing.
For him, that activity has been a key part of keeping on top of his health.
Your mind is clear, you feel better about yourself, and it helps me stay healthy.
Stephen's commitment to his health also extended to regular visits with his doctor, who began to monitor his PSA levels after it was discovered that he had an enlarged prostate.
PSA stands for prostatic specific antigen. It's actually a protein that is produced by the glandular cells within the prostate. Certainly above a certain age, it would be recommended to undergo PSA testing.
The number began to not just creep, but it kind of jumped out of what they feel is the comfort zone. So from there, I opted to go with biopsy.
The diagnosis was prostate cancer.
You hear the word and the first thing you think of is how bad it could be, and is it going to be that bad?
Prostate cancer is a malignancy that results from an uncontrolled proliferation of cells within the prostate gland that ultimately has the capability of invading into blood vessels and surrounding tissues. Not all men do develop symptoms. The large majority don't have symptoms at all. As far as active treatment is concerned, there are many different treatment options relevant.
Stephen talked over those options with Dr. Hirsch and decided to go ahead with radiation therapy.
He specifically chose to do a particular technique of radiation therapy called stereotactic body radiotherapy, implemented with a unique technology called CyberKnife. It creates a very highly precise and concentrated dose distribution to targets within the body, and it very much limits exposure of the normal surrounding tissues.
Stephen's treatment to date has been successful, and his doctors will continue to monitor his health.
I feel good, my confidence is back, I'm me again. It's back to my life.
He's done beautifully so far. The statistics suggest that he should have close to a 95% likelihood of living without any further evidence of his prostate cancer.
With prostate cancer behind him, Stephen's looking to get on the move once again, planning some new adventures with his wife.
Lots of travel. We're back to what we wanted to do and looking ahead. That worry, that anxiety, that's gone.
Stephen hopes his story will encourage others to work with their doctors to keep track of changes in their health.
It's your health. You need to be aware of it and take control of it.
It is very treatable. There are options, and the most important thing is to have a conversation with your physician to understand those options further.